Hello everyone, this is Dr. Asli Al-Amin, General Practitioner from Inpatient Department of TBRC. Our topic of today is Overview of Diabetes Mellitus. The objectives will be what's the diabetes and types of diabetes and incidence, symptoms and signs, diagnosis and complication, and last things will be the management. What is a diabetes? Diabetes is a medical condition that happens when the blood sugar became very high. It happens either due to when the pancreas doesn't produce enough insulin or doesn't produce insulin at all, or if the body tissue is not responding to the insulin in the proper way. Diabetes is affect all the age of people, and it is a chronic medical condition, but all forms and types of diabetes can be managed with the medication and lifestyle change. Type of diabetes mellitus. There's several types of diabetes mellitus, but there's more common 4 types of diabetes. One of this one is type 2 diabetes. This is the most common types of diabetes. It happens when the pancreas doesn't produce enough insulin or body tissue is not responding to insulin in a situation we call insulin resistance. It mainly affects the adult, but it can happen in children also. Pre-diabetes. It's mainly stage before diagnosed as a diabetes. In this situation, the blood glucose will be high, but not too much high or not enough high to be diagnosed as a diabetes or type 2 diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disease. In this situation, the immune system will attack the pancreatic tissue, which produce the insulin for unknown reasons. 10% of people with the diabetes have type 1 diabetes. It's usually diagnosed in children and adults, but it also can be happened at any age. Gestational diabetes. This type of diabetes, it's happening during pregnancy, and it will resolve completely after pregnancy. However, there will be risk of getting type 2 diabetes later on in the life. Other rare types of diabetes, type 3C diabetes. This form of diabetes happen when the pancreas develop injury from outside other than autoimmune damage. It's either due to infection like pancreatitis or pancreatic tumor, cystic fibrosis, hemochromatosis, or if the patient get pancreatectomy by removing his pancreas. Another type of diabetes is called latent autoimmune diabetes in adults. This is like type 1 diabetes. It results from an autoimmune reaction, but it develops much more slowly than type 1. People diagnosed with latent autoimmune diabetes in adults are usually over the age of 30. Maternity onset diabetes of the young, also called monogenic diabetes, happens due to an inherited genetic mutation. There are currently over 10 different types of maternity onset diabetes of young. It affects up to 5% of people with the diabetes and commonly runs in families. Neonatal diabetes. This is a rare form of diabetes that occurs within the first 6 months of life. It's also a form of monogenic diabetes. About 50% of people with neonatal diabetes will have lifelong diabetes, which we call permanent neonatal diabetes mellitus. Other 50%, the diabetes will disappear, this condition within the few months from the onset, but it can come back later in the life. And this situation is called transient neonatal diabetes mellitus. Parietal diabetes. Parietal diabetes is a form of type 1 diabetes that is diagnosed by frequent and severe episodes of high and low blood sugar level. And this is mainly lead to hospitalization. In rare case, pancreas transplantation is the only way of management for parietal diabetes. The incidence of diabetes. About 537 million of adults across the world diagnosed with diabetes, and experts predict this number will increase to 643 million by 2030 and to 783 million by 2045. Symptoms and signs of diabetes. Symptoms are usually more intense and severe in type 1 diabetes rather than type 2 diabetes. What is these symptoms of diabetes? Increased thirst or polytipsia and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tinglings in hand or feet, slow healing of wounds, frequent skin and or vaginal yeast infection. Additional symptoms, it can happen due to according to type of diabetes. For example, type 1 diabetes, because it can develop quickly and lead to severe complication. Mainly the symptoms will be due to the complication. One of these complications is called diabetic ketoacidosis or diabetes related ketoacidosis, which is life-threatening conditions, and symptoms of this will be vomiting, abdominal pain, and ketotic fruity smelling, which we call ketosis, and labored breathing. Type 2 diabetes and pre-diabetes, most of the patient we will not have any symptoms, and it will be just noticed during regular checkup or something with the reading of high blood sugar level before you develop symptoms. Another possible signs of pre-diabetes is darkness of skin in certain area, which we call acanthosis nigricans. Gestational diabetes is also noticed by the healthcare provider during 24 and 28 weeks of pregnancy on regular checkup. Diagnosis of diabetes is made mainly by checking blood glucose level. We have 3 tests of blood glucose. Fasting blood glucose. For this test, the patient or the person should be fast for at least 8 hours before checking the test, as food can greatly affect the blood sugar level. This is usually put as a baseline blood sugar for the patient. Random blood sugar, this can be taken during any time of the day, regardless of fasting or not. And we have hemoglobin A1C or glycated hemoglobin test. This is give us a clue of the blood glucose level over the past 2 to 3 months, and it's used usually to monitor the control of the diabetes after diagnosis or the management of the effect of the management of the diabetes. For gestational diabetes, there's another test called oral glucose tolerance test. Small overview of the reading of the 3 tests to get in each state. For example, fasting blood glucose level in the normal range should be less than 100. If the person in the pre-diabetic state, it will be between 1 to 125. If the patient or the person be diagnosed as diabetic, mainly his fasting blood glucose will be 126 or more. Random blood sugar in the normal range and in the pre-diabetic range, it can be any reading. But if the person in the diabetic become diabetic, mainly his random will be 200 or more, with the classic symptoms of hyperglycemia or hyperglycemic crisis. Hemoglobin A1C, which is one of the most important tests, in the normal range it will be less than 5.7%. If in the pre-diabetic state, it will be 5.7 to 6.4. If more than 6.5 or higher, that means the patient is diabetic. Complication of the diabetes. Diabetes can lead to acute, which it happens suddenly and it's very severe, and long-term complication. Acute complication of the diabetes, most of them are a life-threatening condition. One of these complications, hyperosmolar hyperglycemic state. This complication mainly happen with the people who having type 2 diabetes. It happens when blood sugar levels are very high, over 600 milligram per deciliter for a long period. And this can lead to severe dehydration and confusion, and it's an urgent medical condition, require medical intervention. Diabetes related ketoacidosis, this is mainly complication happening with the people of type 1 diabetes or undiagnosed type 1 diabetes. This is sometimes it becomes the first presenting signs of type 1 diabetes. It happens when body doesn't have enough insulin. In this situation, if the body doesn't have insulin, and then he cannot use the sugar or the glucose like an energy, so it will break down the ketones or the fat in the fatty tissue, and this will release the substance called ketones, which turn the blood to acidotic. And the patient in this situation will have labored breathing, vomiting, nausea, loss of consciousness, and it's also a medical condition, urgent medical condition, which requires urgent medical intervention and sometimes ICU. Severe low blood sugar or hypoglycemia. Hypoglycemia happen when blood sugar level drops below the normal range or the range. Severe hypoglycemia, it's mainly affect people with diabetic affect diabetic people who are using insulin. Signs of hypoglycemia is blurred or double vision, clumsiness, disorientation, and seizure. And absolutely, it's a medical emergencies also, and it's treatment urgently, either with the emergency glucagon or medical intervention. Long-term diabetes complication. This happens because of the effect of high blood sugar on the blood vessels and the nerve, and that will affect also the other organs. So complication on the cardiovascular symptoms, this is the most complication of the diabetes mellitus. It's a cardiac complication, which can be coronary heart disease and heart attack, stroke, and atherosclerosis. Other complication in the nervous system, it can lead to neuropathy, which is mainly presenting by numbness and tingling and pain in the hands and foot. On the kidney, diabetes can lead to nephropathy, which can later on lead to renal failure. On the eye and the retina, we have a condition called retinopathy due to high blood sugar level, which can lead later on to blindness. And we have another complication which we call diabetes related food condition, and which is diabetic. One of this one is diabetic septic food, which can be treated by later on in severe condition by amputation. In the sexual and genital organ, complication can be due to nerve or blood vessel damage, such as erectile dysfunction or vaginal dryness. It can affect also the ear and lead to hearing loss. On the oral cavity, it affects the gum and can cause periodontal disease. On the mental health, People with diabetics are having incidence 2 to 3 times more likely to develop depression rather than normal people. Management of diabetes. Diabetes is a complex condition. So to manage it, we will work on several strategies. In addition, diabetes affects everyone differently, so management plans are highly individualized. The 4 main aspects of managing diabetes include blood sugar monitoring, which is key to determining how treatment plan is working. Then the blood sugar can be monitored frequent check with a glucometer or by finger stick or continuous glucose monitor. Oral diabetes medication help and manage blood sugar levels in people with type 2 diabetes mainly and in the pre-diabetic states. People with gestational diabetes may also, sometimes they are treated by the oral medication. There are different types of this medication, but metformin is the most common and most famous one. Insulin is management of choice in type 1 diabetes. Need to inject synthetic insulin. Some people with type 2 diabetes also can be treated with the insulin. We have several different types of synthetic insulin. Each start to work on the different space and different speeds and last in the body for different lengths of time. The 4 main ways you can take insulin include injectable insulin with a syringe, or insulin pens, insulin pump, and rapid-acting inhaled insulin. Diet, which is a very important part of the plan of the management. But if you have a meal planning and choosing a healthy diet are key aspect of the treatment of the diabetes. Exercise, because physical activity increases insulin sensitivity and help reduce insulin resistance. And it's an important part of management to decrease the risk of heart disease. And also management of blood sugar and blood cholesterol level can help in the management of the diabetes. Prevention and prognosis. There are some diabetic risk factors can be preventable, such as genetic and family history. Cannot be preventable, such as genetic and family history, age and race, which is main factor of type 1 diabetes, and autoimmune type 2 diabetes. Type 2 diabetes can be preventable by modifying risk factors like weight and stress and bad habits. Prognosis depend on several factors: type of diabetes, age at diagnosis, other health condition or other morbid factor, complication of diabetes, control of diabetes. Most of the patients die due to complication, not of the diabetes. Diabetic patient can reduce their risk of complication by maintaining their hemoglobin A1C below 7. And this will be the end. Thank you.